Hello everyone, welcome back to Healthy Care. Have you ever thought that the liver, the quietest organ in your body, might be sending out SOS signals that most of us tend to overlook? Unlike the heart or lungs, the liver doesn't directly cause pain when it's in trouble. But once it speaks up, things might already be serious. What's unique is that the liver doesn't signal distress through pain. Instead, it sends subtle signs right onto your skin, signs that are easy to ignore. Sometimes it's just a small change in color or a mild discomfort, something you might brush off as the weather, lifestyle habits, or simply signs of aging. The truth is, our skin often reflects the state of our internal health. When the liver starts to falter, the first signs frequently show up on the surface of our skin. If we don't recognize and address these signs in time, they could be warning us about more severe liver conditions. So let's dive in and uncover the hidden messages your skin may be sending about your liver's health to protect yourself early, before it's too late. 1. Pale skin. Pale skin is often an overlooked sign of liver-related issues, but it is actually a common symptom that is frequently ignored. The liver plays a crucial role in producing proteins necessary for blood formation, especially albumin and antioxidants. When the liver is not functioning effectively, these proteins are not sufficiently produced, leading to a deficiency of oxygen and iron in the blood. This causes the skin to become pale, losing its rosy, healthy glow. This pallor is especially noticeable in the face and hands, often more pronounced in the morning when the body first wakes up. People with chronic liver disease may observe their skin gradually turning pale or even slightly green, particularly in thin-skinned areas. Unlike anemia caused by diet or other factors, this type of pallor does not improve with iron or vitamin supplementation alone. A study published in Hepatology shows that approximately 30 to 40% of patients with chronic hepatitis and cirrhosis experience anemia symptoms, resulting in pale skin and decreased pigmentation. An accompanying sign is persistent fatigue, even after adequate rest. Additionally, patients may notice that their skin becomes duller and more sallow, especially in cold weather or after strenuous activities, due to reduced blood circulation and oxygen supply to the skin tissues. 2. Spider angiomas. Spider angiomas are one of the characteristic signs of liver disease, but they are easily mistaken for varicose veins or skin aging. This condition involves small blood vessels, usually in the form of capillaries, that dilate and appear prominently on the skin, resembling a star shape with small branches radiating outward. These are most noticeable in thin-skinned areas like the face, neck, and chest. Spider angiomas may appear more frequently as the liver weakens, as it can no longer process toxins, causing them to accumulate in the body. The increased pressure within the liver's vascular system causes these capillaries to swell. Unlike typical varicose veins, spider angiomas have a symmetrical appearance, often present on both sides of the body, and do not disappear, even with skin care or vascular treatments. These angiomas may also feel tender or cause a slight tingling sensation when touched if liver pressure continues to rise. In cases of advanced liver disease, the number of spider angiomas can increase significantly. A study from the University of California found that over 60% of cirrhosis patients develop spider angiomas, with their number and prominence increasing as liver function deteriorates. An analysis in the Journal of Hepatology also reported that having more than 3 spider angiomas on the body, especially on the chest and neck, quadruples the risk of chronic liver damage compared to those without this sign. This is an important warning sign of chronic liver disease, cirrhosis, and fibrosis, warranting a thorough liver examination when detected to assess the degree of damage. 3. Red or pink skin rash. A red or pink rash is a sign of toxin buildup in the body, as the liver cannot effectively eliminate toxins. When these toxins accumulate, they cause inflammation and irritation, resulting in a rash, especially on the face, neck, and chest, and sometimes spreading across the body. A liver-related rash tends to come with a burning sensation, and itching patients may also feel a slight prickling sensation when touching the rash. These red spots not only affect appearance but can also be uncomfortable, often mistaken for an allergic reaction or dermatitis due to unsuitable cosmetics. A study by the U.S. Liver Research Institute recorded that up to 50% of patients with chronic liver disease experience skin rashes, with these spots often unresponsive to topical creams. Moreover, as liver function declines, lipid metabolism in the liver is also affected, causing the body to overreact to certain foods, resulting in widespread red spots after eating foods high in protein or fat. Notably, these rashes often darken when exposed to sunlight, as UV rays stimulate inflamed cells in the damaged skin. In many cases, red rashes are an early warning sign of chronic liver diseases like hepatitis or cirrhosis, and may be accompanied by other symptoms such as fatigue, abdominal pain, or digestive disorders, indicating the need for a checkup to prevent disease progression. 4. Flaky or cracked skin. Flaky, dry, or cracked skin is a common dermatological sign when liver function is impaired. The liver not only serves a detoxifying role but also supplies the nutrients and moisture needed for healthy skin, helping to maintain a natural protective barrier. When the liver weakens, the supply of nutrients and moisture to the skin is also reduced, causing it to become rough, flaky, and prone to cracking, especially in areas like the palms and soles. This condition often does not improve with external moisturizers, as the issue originates internally. A study from the American Academy of Dermatology found that 30 to 40% of chronic liver disease patients exhibit severe dry skin symptoms, especially when albumin levels, a major protein produced by the liver, drop below normal, making it difficult for the skin to retain moisture. Dry skin due to liver weakness is also often accompanied by itching, prompting patients to scratch frequently, which can lead to cuts and even skin infections. In cases of more severe liver disease, flakiness and cracking may extend to the fingernails, causing them to become brittle and easily break. This is a sign of reduced liver function and skin regeneration and protection, indicating that the body struggles to maintain moisture and nutrient balance in the skin. 5. Itchy skin. Itchy skin is a common symptom when the liver cannot effectively filter toxins. causing these substances to accumulate in the blood and irritate nerve endings beneath the skin. This symptom typically appears all over the body, becoming more bothersome at night. After consuming fatty foods or alcohol, as the liver has to work harder but less efficiently. Research from the American Liver Institute indicates that approximately 20 to 30% of chronic liver disease patients, particularly those with cirrhosis, hepatitis, or bile duct obstruction, experience itchy skin. This itching is often concentrated on areas like the palms, soles, or abdomen regions with a high concentration of blood vessels. Itchy skin related to liver disease does not respond well to conventional topical treatments, as the primary cause is toxin accumulation in the blood, rather than external skin irritation. In patients with bile duct obstruction, the itching is often more severe due to bile buildup in the liver, which then enters the bloodstream, causing intense and prolonged itching. Some studies suggest that antihistamines H1 or H2 inhibitors may provide temporary relief, but they do not address the underlying cause unless liver function is improved. 6. Easy bruising. Easy bruising is an important sign indicating that the liver is struggling to produce blood clotting factors. The liver creates proteins that help prevent bleeding and support natural blood clotting. But when its function declines, this process is disrupted, making the skin more sensitive to minor impacts. This leads to bruises appearing without clear causes or even from light touches. Bruises related to liver problems tend to be darker, transitioning from purple to deep brown before fading, and can last for several weeks. Bruises often appear on the arms, legs, or even the abdomen and back, sometimes causing mild pain when touched. According to medical statistics, about 40% of chronic liver disease patients exhibit easy bruising. Additionally, this condition may be accompanied by other bleeding signs, such as bleeding gums or nosebleeds, due to reduced clotting ability. Doctors carefully examine these bruises to assess the level of liver and clotting dysfunction, and often order liver function tests to determine the extent of the damage, allowing for timely treatment to restore blood clotting ability and safeguard overall health. 7. Jaundice. Jaundice is one of the most recognizable and typical signs of liver disease, indicating that the liver is struggling to process bilirubin, a product of red blood cell breakdown. Normally, bilirubin is filtered by the liver and excreted through bile. However, when the liver is damaged, it cannot process bilirubin effectively, causing it to accumulate in the blood and deposit in skin and mucous membranes. This results in a yellow tint in the skin, whites of the eyes, and sometimes even the inside of the mouth. The severity of jaundice can range from mild to deep yellow, depending on the amount of bilirubin buildup. Accompanying symptoms often include dark urine as bilirubin is excreted through the kidneys and pale stool due to a lack of bile in the intestines. According to the International Liver Organization, jaundice appears in about 70 to 80% of patients with conditions such as cirrhosis, hepatitis, and bile duct obstruction. This is a clear sign that the liver has significantly declined in function, especially during the advanced stages of hepatitis or cirrhosis. Liver-related jaundice differs from physiological jaundice in newborns or carotene-induced yellowing, as it is often accompanied by fatigue, itching, and digestive disorders. When bilirubin levels become significantly elevated, patients may feel intense itching, increasing the risk of skin infections from scratching. Experts recommend that when jaundice is observed, patients should undergo immediate liver function tests. Blood tests measuring bilirubin and liver enzymes can help determine the extent of liver damage, enabling timely intervention to prevent disease progression and protect overall health. 8 dark spots on the skin. Dark spots on the skin are commonly seen in individuals with impaired liver function. As the liver cannot effectively eliminate melanin, a natural pigment responsible for skin color. When the liver weakens, melanin accumulates excessively and appears on the skin as dark spots. Especially in frequently exposed areas like the face, neck, and hands. This phenomenon is often mistaken for age spots or melasma. But liver-related dark spots tend to increase in both number and intensity over time, particularly as liver health continues to decline. Liver-related dark spots do not disappear even with typical skincare measures. According to a study from the National Liver Research Institute in Japan, approximately 30% of chronic liver disease patients experience increased melanin pigmentation. Experts explain that when the liver cannot perform its detoxification functions effectively, the body compensates by increasing melanin production to protect the skin from oxidative factors in the blood. Notably, the frequency and severity of these dark spots grow with the level of liver dysfunction, making it an early warning sign of reduced liver efficiency. Liver function tests and monitoring skin changes are essential for identifying the cause and administering timely treatment, helping to prevent further liver damage. 9. Reddened palms. Reddened palms, also known as hot hands, are a distinctive sign often seen in people with chronic liver disease or hepatitis. When liver function declines, the liver's ability to metabolize hormones and detoxify the blood is affected, leading to circulatory issues and dilation of the blood vessels in the palms, creating a characteristic redness. This phenomenon may also be accompanied by a mild burning sensation when touched and typically appears in both hands. Reddened palms can sometimes be mistaken for redness caused by weather or dermatitis, but when related to liver issues, hot hands often persist and may be accompanied by other symptoms. Medical statistics show that approximately 23 to 45% of patients with cirrhosis or chronic hepatitis experience this symptom, especially in the early stages of the disease. A study published in Hepatology International also indicates that reddened palms are an important warning sign, helping to identify liver problems early. When this symptom appears along with other signs such as fatigue, jaundice, and itching, it is highly likely that liver function is severely compromised. Doctors recommend that patients undergo liver function tests, including checking liver enzymes and bilirubin levels, to assess the extent of liver damage when these signs appear. This allows for timely treatment and monitoring to prevent disease progression. 10. Acne. Acne, particularly on the face and back, can be an indirect sign of declining liver function. The liver plays an important role in regulating and balancing hormones, and when it weakens, This ability is impaired, leading to hormonal imbalances that cause acne to appear and spread more easily. Additionally, when the liver cannot adequately detoxify, toxins accumulate in the blood and are eliminated through the skin. This increases the likelihood of clogged pores, which in turn raises the risk of inflammation and acne. Liver-related acne is often clustered, red, swollen, and more difficult to heal than typical acne. Research published in the Journal of Clinical Endocrinology and Metabolism shows that hormonal imbalances linked to liver weakness can increase the risk of acne by up to 20 to 30%, especially in adults with complex endocrine activity. People with liver issues often find that their acne does not improve much. Even with acne creams or skincare treatments, because the root cause lies in the liver's decreased function. Once the liver is supported and restored, toxins in the blood gradually decrease, hormones stabilize, and acne begins to improve. Doctors recommend addressing both liver function and hormone regulation for persistent acne that shows no improvement to increase treatment effectiveness and reduce acne recurrence. Through this video, we hope you've gained a deeper understanding of the strong connection between your skin and liver health. Sometimes just a small change in skin color or a slight discomfort can be an early warning signal your body quietly sends out. These signs might be fleeting or subtle, easy to overlook amidst a busy life. But don't ignore them. Timely detection can be the key to preventing serious liver-related complications, protecting you from potential health risks. A healthy liver not only keeps your skin radiant, but also serves as the foundation for an energetic and sustainable life. If you found this information helpful, don't forget to hit the subscribe button on Healthy Care to stay updated with the latest health knowledge. Let's protect our health from the smallest things, for a healthier life every day. Thank you for watching, and see you in the next video.